Hi, I'm Dr. Scott Mitchell, President and CEO of Samaracare Counseling Center, and I'm also a licensed clinical psychologist. If you're feeling on edge, you're not alone. In a matter of a few days, we have gone from living life as usual to a loss of our sense of routine. You may feel anger, anxiety, frustration, fatigue, and even despair as the world around us comes to a halt. I was asked to speak to you about how you can keep your stress levels managed and therefore your overall mental health healthy, which in turn will keep our relationships and communities strong and healthy as well. The coronavirus crisis is very different from other tragic events in our nation's history. What is different with this pandemic crisis is at the very moment when many of us need the reassurance and the support of community, we're hustled into isolation. At the very moment when we most desperately crave distraction, many of our favorite means of release are off limits. In most other disasters, we are typically encouraged to flock toward each other, to bolster each other, to bolster local businesses and reclaim normalcy. However, this crisis, we must stay apart and conquer this virus. I was reminded of the critical importance of emotional and relational connection on several levels this week. On the national news, the image of a young woman outside her grandfather's assisted living facility, her hand extended showing him her engagement ring, and the grandfather peering out with joy but some tears. The story also of high school students off from college banding together to purchase groceries for elderly in their community. These are all creative examples of how we can maintain connection while keeping ourselves distant. What then can we do to maintain good mental health and prevent ourselves from moving into despair? First, we can practice mindfulness. I know that sounds simple, we hear that all the time, but taking deep, simple, slow breaths is at the core of mindfulness. We know that slow breathing improves our emotional and psychological well-being in a number of measurable ways. Anxiety and stress will challenge us, but calm, slow breathing can center us again and again. There are a number of great apps you can access online while at home to read about mindfulness and deep breathing. Focus on good enough. This is time to let go of doing everything exactly right or think about long-term things. Rather, aim for good enough. This means focusing on the here and now, day-by-day decisions. Live in the gray. Our natural tendency is to move toward black and white thinking when we're anxious or stressed. Allow yourselves to be okay without clear answers. We'll figure this out together. Be patient and flexible. Expect that your partner, your children, family, and friends are all going to be more anxious, stressed, and irritable. Remember that everyone around you is struggling with a sense of lack of control and powerlessness. Be aware when you begin to turn to less healthy coping mechanisms like alcohol, drugs, overeating, oversleeping. These things can all make us feel better in the short term, but they ultimately will wear us down, leave us more vulnerable to the impact of intense social anxiety. Remember also those who are struggling with depression, anxiety, or social isolation. Find ways within limits of social distance to keep connected, to let them know you care. We at Samaracare Counseling know that a simple phone call, an email, or an old-fashioned card in the mail can make a huge difference to those folks. Finally, no matter what your faith or spiritual perspective, I would encourage you to draw upon that important part of your life. Some words from the Christian tradition found in the Old Testament read, "Don't be afraid, for I am with you. Don't be discouraged, for I am God. I will strengthen you and help you. I will hold you up." These words of comfort and spiritual connection can help us to move through literally anything. While there is troubling news about this virus everywhere we look, there is also good news about the successful work that our scientific community is doing to combat the virus and save lives. Take a look at both of those things. Remember, taking care of yourself emotionally and psychologically will help your friends and your families cope with this stress better and continue to keep our community strong. I hope you found some of these thoughts that I have shared helpful. We at Samaracare Counseling are here to help. If you need more information about counseling or some of what I've said, visit our website at samaracarecounseling.org. In the coming weeks, Samaracare will have other similar talks like this one, focused on how to help children, how to help seniors, and one in a Spanish version. I hope all of this will be helpful to you as well. Blessings to you and your family throughout this crisis.